Good morning to all our participants. Thank you for joining us today. To help facilitate today's lecture, may we call on Ms. Evangeline Ariola, the Assistant Director for Training and Research Development of PNMC. Good morning, Ms. Banji.
Hi, thank you, Miss Day. So, good morning, everyone, and welcome to the first part of our lecture series entitled Infection Prevention and Control Nursing Practices for COVID-19. But before we proceed to the lecture proper, so let us hear first from our beloved Senior Vice President for Medical Affairs of QualiMed Health Network. So he is a regent of the Philippine College of Surgeons. He is the director of the PCS Commission on Cancer, President, ERA Society Philippines, Co-Director, Medical Advisory Council, Healthway Cancer Care Institute, General Manager, Ayala Group Employees Care Center, Clinical Associate Professor, part-time, University of the Philippines College of Medicine, Philippine General Hospital. Let us hear from our Senior Vice President, Dr. Manuel Francisco T. Rojas.
you. Thank you, Vanji. They call me Rami for short kasi masyadong marami. Mahaba ang Manuel Francisco, very controversial pa. So you can call me Rami Rojas for short. First of all, I would like to thank PSQM for inviting me. I'd like to also thank all you participants here for attending today, as well as for the speakers, for all the notable speakers invited to speak today. Thank you for taking time out for this webinar. I think if there's anything this pandemic has shown us kung ano ang importante sa Philippine healthcare ngayon, number one, infection control, syempre, di ba? And number two, yung nurses. And we need to recognize these two important components if we are to move forward and achieve a better healthcare sa Pilipinas, no? Because we cannot go back to the past, di ba? Before the pandemic, our healthcare has to improve. From what we have learned from the pandemic, we have to make a better system to meet future pandemics and also to take care of our people. So I'm very glad that PSQM has initiated this webinar series for you, our nurses, and specifically talking about infection control. As you know, I am also new to this position, and AC Health has become majority shareholder and controlling stakes QualiMed. We in QualiMed are a part of a bigger ecosystem of AC Health, which also includes drug distribution, IT, primary care clinics, and specialty clinics of Healthway, and then of course our hospitals under QualiMed. So I am saying this because you have a big role in this big endeavor of AC Health to try to change Philippine healthcare and move it forward. We're also building a cancer hospital in Taguig, which will be up in 3 years, the first standalone cancer hospital in the country. So I hope you will appreciate na habang importante kayo sa ecosystem natin, and we need to work harder kasi we all have a very privileged and important role to play to make this ecosystem work. And one of these little things like these webinars are a step in that direction. So without further ado, I'd like to again thank you for attending, and congratulations to the organizers and Dr. Regina Nazareth also, the head of PSQM. Thank you very much, and I hope you learn a lot.
Thank you very much, Dr. Rami, for a very inspiring message. So, I will now introduce our speaker for today. She is the Infection Prevention and Control Nurse of the National Kidney and Transplant Institute, former Infection Control Nurse of the DOH Research Institute for Tropical Medicine, contributor and trainer of the DOH Antimicrobial Stewardship Training for Allied Health Professionals and Infection Prevention and Control Training Module. She is also a member of the Technical Working Group of the National Standards for Infection Control in Health Facilities. Scientific Committee member, Philippine Hospital Infection Control Society. She graduated from the University of the East Ramon Magsaysay Memorial Medical Center for her Master of Science in Nursing, major in Adult Health Nursing, and obtained her degree in Bachelor of Science in Nursing from the University of Perpetual Health System, Delta. Colleagues, friends, ladies and gentlemen, join me in welcoming our distinguished speaker for today, Ms. Maria Lourdes Bernadeth Manipon, RN MSN.
Good morning, everyone. Good morning, Ma'am Vanji. Just like Dr. Rojas, because of my very long name, Berna na lang pong itawag niyo sa akin. Ayan. So, first and foremost, I would like to thank the organizers of this lecture series. This is going to be a two-part lecture series for infection prevention and control. And the following lectures will be given by my other infection control nurse in NKTI. So I will be now sharing my slides. I hope you can see it because we will be talking about now the epidemiology and chain of infection. This is going to be the first part, again, of our lecture series. So first, I would like to share our team in NKTI. So we are a four-man team. We are headed by Dr. Raquel Ecarma, an infectious disease specialist for adult health. I am also part of the team together with Ma'am Febe De La Cruz and Ma'am Vea Florentino. So again, this is the IPC team of NKTI. So first, I would like to just give a quick background of our lecture series. We all know that we have to stick with the basics. If we have our basics, if we are founded in the good basics po, alam po natin how we will go about on this pandemic. And that is why we want to share the basic principles of IPC for you this morning. The question is, how does an infection occur? We all know that an infection will occur because of the chain of infection. The chain of infection consists of 6 chains. It all starts with the infectious agent. The infectious agent could be any bacteria, any virus, any microorganism. From that infectious agent comes now your reservoir or the environment. So it could be any vector, it could be animals, it could be humans, it could be the environment as well. From the reservoir comes now our portal of exit. The portal of exit could be through coughing, through sneezing, through talking, through other modes like whenever we will defecate, through our feces, through our to our skin because of punctured wounds, through wounds for wound drainages. That could also be a portal of exit. From our portal of exit comes now our mode of transmission, in which our mode of transition, I do hope that our nurses will be able to answer this remotely. So our mode of transmission consists of 3 major modes. So our contact, our droplet, and our airborne. And we will be going through with them one by one later on. And of course, from the mode of transmission comes now your portal of entry. So what is the portal of entry? The portal of entry could be our eyes, our nose, and our mouth through inhalation, through ingestion, through consumption, or whenever we will have open wounds as well. So that could be a portal of entry. And in the last chain comes now your susceptible host. The susceptible host could be the very young and the very old. And we will be focusing from the chain of infection, the three important epitriad that we have. So that will be the source or the reservoir of the infectious agent, the susceptible host with the portal of entry to the reception to the agent, and the mode of transmission to the agent. First, the source or the reservoir. The source of the reservoir again could be any bacteria or viruses. It could be any microbe. Others that are very uncommon sources of communicable diseases could also be fungi, could also be mites, for that example, in which these germs or these microorganisms can be found in the environmental surfaces that we have. We all know that our germs or this bacteria all loves wet, moist, and dark environment. So that will be the three basic things that we need to understand in order for us to prevent their replication, is to prevent anything that is moist, that is wet, and with no proper light or sunlight. And from there, your sources could also be, of course, the people. So the some germs or some organisms and even viruses can be found in humans. So just like for your COVID now, when it all started from a vector, when humans consume that vector, eventually the sources of COVID could be transferred from human to human as well. From the reservoir or the agent, this is very important because we need to understand that some bacteria or viruses can thrive in the environment for long periods of time. Some of these germs or some of these bacteria can last for up to 30 months, just like your Klebsiella. Or others in which we are all familiar is like your TB. Your TB can stay in the environment for 4 months. And I'm just going to share that we found a study online and they are saying that the COVID-19 virus can still be seen in the environment for an average of until 5 days. So why is this very important? This is important for us to know that whenever we want to break any part of the chain, your good environmental cleaning and disinfection will play a vital role. Whenever we will try to uh, clean our environment, it has to be executed well, and it also needs to be done properly with the proper technique. And your environmental cleaning and disinfection will be later be talked about, or we'll have an in focus discussion on it on the second part of the lecture series. So from your environment or your agent or the sources or from the reservoir comes now your susceptible host. Your susceptible host, of course, can be played by many factors. It could be because of the age, because of the underlying illness, or it could be because of the immune status of the individual. This is very important because we need to understand that whenever you will have an immunosuppressed patient, they are very at risk of acquiring any type of infection, may it be COVID or other forms of infection that they will have in the hospital setting. This is also why IPC, or Infection Prevention and Control, advocates for vaccination as well. If you can see from the three modes of transmission, for the airborne transmission, we have examples would be TB, we have also varicella, we also have measles. Among the three, two of them are already vaccine preventable. That is why we cannot also overemphasize the importance of being immune or having your immunization taken whenever it is available. That is why if you will have a readily available vaccine for COVID, please do get a hold of whatever
Asa!
available vaccine that we have now. From your susceptible host, we will be now focusing on the mode of transmission. Again, the three common modes or principal routes of our transmission will be your contact transmission, droplet transmission, and your airborne transmission. And a lot of our organisms can have different modes of transmission. They can also be one or two more types of transmission. And we will be talking about first the most common or your contact transmission. Your contact transmission can be divided into two subgroups, your direct contact or indirect contact. Your direct contact could be skin to skin. For example, your chicken pox, whenever the rashes are there, the rashes or the lesions, whenever you come in contact directly skin to skin, you can directly have the varicella. Examples could also be scabies. There, skin to skin contact with a patient with scabies could also put you on a risk of acquiring it. Examples now of your indirect contact is whenever you have a contaminated surface, for example, and you come in contact with that contaminated surface, and unfortunately you did not perform hand hygiene, and you, for example, you scratch your eyes, or you failed to wash your hands, and then you ate with your dirty fingers or your dirty hands. So that could also fall on your indirect contact. So from your contact transmission comes now your droplet transmission. Your droplet transmission is another mode of transmission. Technically, it could also be form of a contact transmission. Why? Because relatively your droplets are very big. So this droplets are relatively bigger, or they are more than 5 microns in size. Because they are bigger, they can easily drop in the environment within 3 feet. That is why your spatial separation is very, very important when it comes to droplet precaution or transmission. Droplet transmission can also be generated, of course, by an infected person through coughing, through sneezing, or even talking. That is why now in the advent of the pandemic, everyone is advocated to have the mask, to don the mask properly. Of course, when you don the mask, be sure to always cover your nose up to your chin. From the droplet transmission, we will be talking about now your airborne transmission. But I will just want to share this graphical, or this figure, or this picture with you. So this is just a quick comparison from your droplet to your human hair. So your droplets could really be relatively small. However, if your droplets are now small, your droplet nuclei, or that will fall on the airborne transmission, are much smaller. So they could be less than 5 microns in size. That is why for your airborne transmission, unlike your droplet transmission wherein they can easily drop within 3 feet, your airborne transmission now can be dispersed over long distances, especially if you have a good air current. That is also why now, to prevent the transmission of one person with COVID to another, proper ventilation of our rooms is very, very important. If you have an air-conditioned room, relatively, it has a poor to low air change per hour, meaning the number of times that the air in that room will be changed will be relatively 2 to 3 times per hour only. But if you will open now your windows, magbukas lang po ng konting bintana, open your doors already, that could give you a significant change when it comes to the transmission. Because in airborne transmission, they cannot, hindi lang po sila can be dispersed over long distances, but they can also stay within the environment for long periods of hours. That is why, for example, I am a TB patient. I have been coughing inside a particular room. That room is an air-conditioned room, for example. I am no longer in that room. And a susceptible individual, an individual with comorbidity, a senior citizen, comes inside that room. I am not present already in that room, but that particular susceptible host can still be infected of my TB bacilli that is floating around in that room. So it is very, very important again to maintain a good ventilation in our rooms to prevent your airborne transmission. We all have to remember that because we are in the hospital setting, we are in the clinical setting, all of these microorganisms, all of these agents, all of this risk really is within our reach. That is why the goal of infection prevention and control is to break any part of our chain of infection or any part of the chain. We break from the infectious agent to the reservoir, from the reservoir to the portal of exit, from the portal of exit to the mode of transmission, and so on, before it arrived to a susceptible host. And of course, one of the things that we will need to discuss in order for us to break that chain or prevent these infections is to discuss now your isolation precaution. Your isolation precaution is what we commonly know before as your universal precaution. So your universal precaution was added by the CDC last August of 1987. It is also part of the OSHA standards for bloodborne pathogen. However, your universal precaution was changed last 1996 into standard precaution. So this is what we now know as standard precaution. And when we say standard precaution, this is a group of precautions that we need to employ to any individual or any person or any patient that we have. And your standard precaution is composed of the following. It's your hand hygiene, your PPE, your patient placement, your respiratory hygiene and cough etiquette, your textile and laundry, safe injection practices, and cleaning and disinfection. And I do hope you will appreciate this because whenever we have a good foundation in everything, kung alam po natin ang importansya ng bagay na ito, mape-prevent po natin na magkaroon tayo ng any COVID transmission from healthcare to one healthcare personnel to the other, or from the healthcare personnel to a possible patient, or from a patient to a healthcare personnel. That is why first, we cannot overemphasize the importance of the simplest and most effective way of preventing the spread of any infection, because in a healthcare setting, it is really the healthcare workers' hands that is the main culprit of cross-contamination or acquiring healthcare associated infections from our patients. So hand hygiene is very, very important. Hand hygiene is also behavioral. We cannot wash our hands for you. We cannot wash your hands for you. You can only do it for yourself. That is why, please, whenever you will have the opportunity to wash your hand, whenever you will have a contact with any patient, with any surface, you have to perform your hand hygiene. And you can perform your hand hygiene by two ways. It's either using your soap and water through hand washing, and using your alcohol-based hand rub or your hand rubbing. Again, the two procedures will entail you in performing the hand hygiene, that is hand rubbing and hand washing. And it only takes 6 steps to perform now your hand hygiene. And this is based from the World Health Organization. You can perform it by palm to palm, ayan, by palm to palm. Now with your fingers interlaced in the dorsum of your right hand, and then vice versa to your left hand. And then palm to palm with fingers interlaced. Next is from your knuckles. and then your thumb, and lastly, your fingertips. And I do hope that the Infection Prevention and Control Committee will be able to spot audit you from time to time. If kabisado po ninyo ang steps ng hand hygiene, it is very important for us na kabisado po natin ang steps na ito, because whenever we will miss one step or one procedure in the hand hygiene, it will entail a missed area in our hand wherein the microorganism can replicate. Remember, there are already commensal microorganisms present in our hands, and we need to perform hand hygiene because, of course, it only takes a few seconds of them to replicate in our hands. And a quick reminder, whenever we will perform hand hygiene, we have to ensure that our nails are short with no nail polish. We also have to ensure that we do not have any watches or rings. Question, do we allow wedding rings? We do, as long as it's flat without any stone. So if you have a wedding ring, always ensure that you will move your ring and then you will rub below it. So that will be your seventh step. Oh, so remember, if you are wearing your wedding ring, a flat ring rather, so you will move your ring and make sure that you will rub below it or beneath it. Next, of course, is we need to have short sleeves. So if you are wearing long sleeves or your coats, ensure that you will always fold them at least on your elbow, at least 3/4 po, that there. And of course, we need to perform hand hygiene by using our 5 moments. So what are the 5 moments for hand hygiene? What are the 5 moments of hand hygiene? Ayan, unfortunately, hindi ko po kayo maririnig. What are the 5 moments? Your 5 moments is before patient contact, and then before clean or aseptic procedure, after contact with body fluid exposure, after patient contact, and after contact with your patient surroundings. Again, your 5 moments will be before touching your patient, before clean or aseptic procedure, after blood or body fluid exposure, after touching the patient, and after touching the patient's surroundings. So please do remember, you have to perform hand hygiene whenever you will perform vital signs taking, after actually writing on the patient's chart, because that is still part of the patient environment, after touching your IV fluids, after collecting your any sample, before you actually go to the patient, before you don your PPE, before you go inside the patient room, please do perform your hand hygiene. Question, of course, yan, may sagot na. Do we need to perform hand hygiene after glove use? Yes. Remember that the microorganisms or the germs love dark environment, moist and wet environment. And what happens to our hands whenever we will put or have our gloves? Of course, yung iba po dyan, pinagpapawisan, pasmado pa. And remember, it only takes a few seconds for that microorganism or those germs to replicate. That is why it is very, very important that we perform hand hygiene after glove use. And of course, whenever you will use any gloves, it doesn't give you the right to also check your phone, to also grab your pen, or do any procedure other than the intended procedure that or other than your planned procedure to the patient. The reason why you donned your gloves, of course, because it will give you it will now cross-contaminate any environment in the patient care setting. So pag po nagsuot ng gloves, please, pag nagsuot ng gloves intended for the blood extraction procedure, yun lang po yung gagawin natin, ensuring that all your articles are already prepared before that procedure to prevent us now of touching any part of the patient environment and contaminating, and even or even giving a risk to our patient because of our contaminated gloves. Next part of your standard precaution now is your PPE. However, we will have an in-depth discussion for your PPE in the second part. And your PPE are specialized equipment ranging from your gloves, respiratory protection, face and eye protection, your gown, your apron. And this specialized equipment will be discussed again in depth in the second part of the lecture. Part of course also of standard precaution is your patient placement. So what is important in patient placement is that we place our patient, especially if we still do not know the mode of transmission or the disease that the patient has, or we're not very sure of the ability or the capability of the virus. For example, on that particular patient to transfer to another patient, we ensure that that patient be placed in a single room. This is also the reason why in the start of the pandemic we try to be cautious when it comes to our PPE and in handling our COVID patients. However, of course, we have now a vast evidence or by paper the type of the transmission that COVID has, and the two major modes of transmission for COVID will be your contact precaution and your droplet precaution. However, airborne transmission or airborne precaution should still be employed to our patients whenever we will perform aerosol generating procedures. And what are aerosol generating procedures that we will perform to COVID patients? It could be nebulization, intubation, extubation, high flow oxygenation of more than 15 liters, open suctioning. So that could be forms of aerosol generating procedures. CPR is also part of your AGPs. And whenever we will perform AGPs, we have to employ now your airborne transmission. If you have a lot of COVID patients, you can also cohort them, meaning you can place all of those patients with the same disease transmission and the same disease in a single room or in a ward type. However, if that patient, for example, patient A has COVID and patient B has COVID plus an MDRO or any multi-drug resistant organism present, that particular patient with COVID and MDRO should be in a single room and not in a ward type area or room. We are only cohorting patients with the same disease and same disease transmission, meaning you cannot cohort a TB patient and a measles patient because they are both airborne. No, you can just cohort a TB patient and cohort separately the measles patient or the varicella patients for that matter. Again, we only cohort the same disease and same disease transmission for our patient. Of course, limit transmission or limit transfers for our patients. This is to prevent cross transmission of our other areas and other facilities. And part of your standard next will be your respiratory hygiene and cough etiquette. This standard was included by CDC because of the SARS outbreak before, in which they noted that a good source control measure, meaning if I am already infected or colonized with an infectious agent and I will don a mask, it now prevents my microorganisms or my bacteria or my droplet to be transferred to others because I already have the mask. And part of your source control measure for respiratory hygiene and cough etiquette is good cough etiquette, wherein we have to cough using our elbows, covering our mouth and our nose na dapat po downwards, okay? And we can also use tissues for that matter and disposing them properly in a yellow lined waste bin or in our infectious waste. And part also of this program is posters and reminders for our patient. I do remember that my one of my mentor will always say before and even pandemic started, piso lang naman ang mask. If ever there will be patients who have coughs or colds, please do distribute them. So this could also be one of the measures wherein Qualimed can adopt whenever you will have visitors or patients who do not have, if now there will still be patients who still do not have masks, you can distribute them upon admission, one piece of mask for them to always have on. Next, of course, is your textile and laundry. Just for textile and laundry, the basic principle is less agitation, less manipulation of your fabrics. So, hindi po dapat pinapagpag. And next, for standard precaution will be your safe injection practices. So, the key here is as much as possible, we will not use multi-dose vials. And if we will use needles, we will not bend them, we will not recap them, and we will not hand break them or hand manipulate any of our needles to prevent any needle stick injury. So we also have to dispose our sharps and needles in a puncture-resistant containers. Also, next for your standard precaution will be your cleaning and disinfection. And an in-focus discussion for your cleaning and disinfection will be done in the second part of this lecture series. So we will not talk about that. So that's it for your standard precaution. From your standard precaution, a part of your isolation precaution, remember that isolation precaution is a two-tier precaution. We already discussed the standard, and part of the isolation precaution now is your transmission-based precaution. And your transmission-based precaution is, of course, anchored on your three common modes of transmission, in which it is your contact, your droplet, and your airborne precaution. Under contact precaution, again, contact precaution entails that we place our patient in single rooms. If a single room will not be available or a lot of your patients already has COVID, for example, you can cohort them. Just ensure that there is at least a spatial separation of at least 3 feet or the proper physical distancing from one bed to the other. Part of your contact precaution, of course, is we properly don our PPE. So what is the PPE intended for contact precaution? It is your gown and your gloves. That is why for COVID, it is recommended because COVID falls in the contact precaution that we have our gowns and our gloves. Okay? Next is your droplet precaution. Your droplet precaution, of course, if you have an available single rooms is very, very recommended. It is the preferred admission area for them. The spatial separation of more than 3 feet is very, very important as well. However, special air handling or ventilation is not required, meaning your negative pressure is not required for a droplet precaution. Examples of your diseases that falls under droplet will be your pertussis, meningo, pneumonia. It could also be diphtheria. So those are just a few examples under your droplet precaution. And for droplet precaution, the PPE is your surgical mask. That is why in COVID as well, we recommend the use of masks. That is also the reason why, because of the continued community transmission, donning of masks is very important in the community. Next, under transmission-based precaution is your airborne precaution. Again, your airborne precaution, because they are relatively smaller, this droplet nuclei or these aerosols are very, very small or less than 5 microns in size. They need to be in a special room or a special air handling ventilation area or your airborne infection isolation room or your negative pressure room, in which that particular room ensures that all of the air within the patient will not be exhausted in the hallways wherein other healthcare workers will be present, but it will be exhausted using a mechanism. It will be exhausted following a good filtration and safely thrown outside the community na malinis na po siya. Remember, if you will have a negative pressure room, ensure that the air exhausted from inside the patient room will be filtered so as it will be clean and hindi po tayo mag-pose ng great environmental risk to our neighboring hospitals or in the pedestrian or in our community. Of course, under airborne precaution, non-immune healthcare workers should not take care of them. Meaning, for example, if you are previously been infected with measles during your childhood days, so you could be the one taking care of a measles patient. But in COVID, unfortunately, we still do not have the right data of the duration whenever our previously infected COVID-19 healthcare workers will have the antibodies present to them. This is also the reason why we still need to have the proper PPEs whenever we will be taking care of them. So for your airborne precaution, your N95 mask is very, very important. If you will be donning your N95 mask, please, and I do hope your Infection Prevention and Control Committee has been doing this, in which you will be undergoing your respirator fit testing. Your respirator fit testing could be two ways. It could be your quantitative, wherein you will have a machine that actually measures the amount of leakage in the mask, or the qualitative type, wherein you will be subjected into different solutions. It could be the banana solution, the sweet solution, or the bitter solution. So your fit testing is very important for us to know if that is the correct size of the N95 for you. So not all N95 are the same size. It's not one size fits all policy. So you need to have a good and a properly trained IPC to perform this. So again, your respirator fit testing should be done on a regular basis, in which it should be done annually. But if in any case that you will change the brand of the N95, for example, January you have the 3M N95 1860, and come December you have a different brand. For example, you now have the Honeywell N95. So you still need to perform fit testing by December. But if you will have the same N95 supply, meaning that you will have the same N95 from January until next year, the January, you will still perform now the fit testing on an annual basis. But in any time that the healthcare worker will gain weight, will have a surgical procedure that will have a facial change, so fit testing should be done immediately, meaning you will not have to wait until 1 year to fit test that individual. So you need to fit test that healthcare worker immediately. Again, this is for N95. So your standard precaution applies for all your patient. And if you already know the transmission of your patient or the disease type that your patient has, it will now be standard precaution plus your contact precaution, standard precaution plus droplet, standard precaution plus your airborne precaution. And remember, diseases can have 2 or 3 modes of transmission, in which for example, yung COVID po natin, COVID has contact, COVID also has droplet, and if you will be performing aerosol generating procedures to your patient, it could also be airborne precaution. So that's it for the basics, the epidemiology and the chain of infection. And if you will have questions now, I can entertain them already. So I do hope that you have questions para po ma-address po natin. But yes, we will have an in-depth discussion of the PPE, what is the recommended PPE for COVID, the updates on that, and the environmental cleaning and disinfection in the second part of this lecture series. Ma'am Vanji?
Okay. Thank you, Ms.
Yes po,
Berna, for
ma'am.
that very informative and insightful lecture. I know that it's been very busy on your end. Thank you for taking time to be with
Yes,
us
ma'am. Of
today.
course,
So,
ma'am.
alam namin even if you're so busy, you still give us the time. And I would also like to thank Dr. Gina Nazareth for making the impossible possible. So, okay, so there are no questions in the box, but I think I would throw the first question.
Sige po, ma'am.
So, you mentioned on your lecture that with safe injection practices, we should not rehab. Of course, I think every healthcare worker who's using sharps are um, are aware of this. And then there is like a phrase that do not break or bend. So I remember before that there are hub cutters.
Mm-hmm.
So do you think it is still recommended because we cut the hub of the needles from the
Mm-hmm.
syringe. So is it still applicable up now?
You can still use it, ma'am. However, it will be safer to just dispose the whole needle and plus the plunger and the syringe in the puncture-resistant containers with no other manipulation. But yes, you can still do that. However, ma'am, the hub cutters can pose a risk for any sharps injury. Of course, it will also entail that the healthcare worker is aware on how to use it. Some healthcare workers before will have the cap on and use the hub cutters. So it will now make your hub cutters, or it will be difficult for the hub cutters to cut now the needle part of the syringe. But yes, it will be safer to just dispose entirely without any manipulation your syringe and your needles in a puncture resistant container.
Very much. So, do we have any questions from the group? Anybody?
I have a question for Berna.
Yes
Hi,
po.
Berna. This is Dr. Nazareth.
Yes,
I
Doc. Good
got
morning.
you were really recommended by Dr. Chal, si Ricky. O yon. Kaya nakatextan ko siya ngayon. And I'm really
Opo.
happy that you were able to share your time with us. Berna, my question is, like for example, diba, you mentioned a while ago about the single dose, no? As much as possible, you want single
Yes,
dose,
ma'am.
no? What can you advise us, no? Can you advise us regarding, kasi 'di ba, yung AstraZeneca
Mm.
vials, 'di ba, multi-dose yan eh. Oo. Is there anything that we should know, no, while doing the vaccination? Oo.
Actually po, ma'am, in NKTI, we opted to have a different aspirator from the vaccinator. This is to ensure that the one who will be manipulating now the multi-dose vials will be just that one person, and they will be observed by our pharmacists. So it will also ensure the correct aspiration or the recommended dose po for the multi-dose vial.
So, no room for
One
error.
recommendation, opo, yun po yung ginagawa namin, Doktora, a separate aspirator. However, that's not part of the DOH
Yeah,
recommendation
I
when
know.
it comes to personnel. Opo.
Yes, yes,
Pero sa
additional
amin po
personnel.
kasi, yes po, sa amin po, we opted to have a different aspirator. Para pag na-aspirate na po, Doktora, i-administer na lang po ng mga vaccinators po namin. And ensure lang po natin, Doktora, that the use of the multi-dose vial will not be, yung natira po, Doktora, doon, ay hindi po ihalo doon sa kabilang multi-dose. Because I do believe that the AstraZeneca vaccine can have at least 10 to 12 doses per vial.
Mhm.
Minsan po, kapag maganda yung pag-aspirate, na ma-maximize po kasi yun. But, however, syempre po, ang gusto po natin is uh, 10 doses lang kasi yun lang naman din po yung recommended. Pero sa amin po kasi na ma-maximize po namin yung doc. So ensure lang po that every time that the healthcare worker will aspirate in the vial, they will disinfect the hub every time that they will aspirate or the rubber part of the vial, Doktora.
Okay, thank you. Thank you, Berna.
Yes po, Doc.
Okay, so we have another question here. Are respirators with filters and cartridges effective in protecting healthcare workers from COVID-19 as compared to N95, which is better?
Ayan. So, actually, magkakaroon nga po ng separate discussion when it comes to PPE. But to answer your question, your N95 and the higher respirators, meaning your half face piece respirators, your full face piece respirators, can still protect you in any airborne diseases or airborne transmission. Meaning that it is at par with any respirators that we have, your N95. So, kung N95 po ang gagamitin natin versus a P100 respirator, your half or full face piece, mapoproteksyonan pa rin po tayo sa COVID. But, the proper way of donning it, the fit testing, the proper cleaning and disinfection should be done properly. Because if it's not done properly, then the healthcare worker might be at risk of having self-contamination in the removal or in the doffing process. That is why a good return demonstration with your infection prevention and control should be done. Correct cleaning and disinfection demonstration by your IPC should be done as well. They can have posters po para to educate you on how to properly disinfect them. And of course, we have to remember that whenever we are using your full face piece or half face piece respirator, in storing them, your filters will have to be disconnected with your respirator. Yung iba po kasi sinasama na po siya sa storage yung filters. Remember that your filters will have to be disconnected. If your filters are the box type cartridges, versus your pancake type or the open type filters, your box type will have to be wiped before storing. Storing them will be ano bang term? Pisngi sa pisngi. Ibig sabihin, from the connecting hub, it should be the connecting hub facing outside, and you have to use a clean, breathable bag in order for you to store them. Remember, germs and bacteria love dark, moist, and wet environment, and breathable paper bags will prevent you from having that. So please do have a separate for that, and clean your respirators every use. You can remove the facial oil and then run them with soap and water before a disinfectant. The disinfectant could be bleach with the ratio of 1:100. But if your respirators are fully soaked with blood or body fluid, you have to use a 1:10 ratio for your disinfectant. Dry them and store them properly. For your N95s naman po, just ensure that you're not using N95s with valves or KN95 with valves. There have been studies in abroad, and even CDC is saying that your valves could pose a risk, especially if you are a previously infected COVID-19 patient. Nagkakaroon pa rin ng exit, especially if you'll be assigned in the operating room, for example, that you need to have a sterile environment. So no po ang may exhalation valves sa mga respirators for that case. But yes, N95 or P100 respirator will have no difference in protecting you when it comes to airborne transmission.
Okay, thank you for that very extensive response. I think you have already covered how to use the respirators and N95 properly. So another question in Qualimed, we have COVID home care patients. Can you share some of the most important tips that carers can practice when taking care of their COVID patients at home?
Mm. So, one of the basic thing po na meron tayo, of course, if you will follow the standard precaution, dapat po single room po sila. So, hopefully, they also have a separate comfort rooms or lavatories in their homes. Hindi po dapat shared yun. They will also have a separate utensils or they will have dedicated equipment for them. If they will be inside a room or air conditioned room, they can still use their air conditioners as long as they will also have a small opening from the windows po nila to have a good source of air. Of course, a good ventilation or good air movement should be maintained. Remember, when I shared that an air-conditioned room will have a low to no air changes, so opening of windows will have a significant decrease of the aerosols present in that room. Of course, if you will also be changing the linens of that patient, remember to separate them. Remember to also not mix your disinfectant or your bleach to your soap and water. Ayan, basic po yan. Kasi minsan nagkakamali po, hinahalo ang Zonrox sa Downy. Ayan. So in the presence of any enzymatic agents or any soap and water, your disinfectant will be ineffective. So at home, you can separate the linen, wash them first with soap and water before you apply the disinfectant. However, if those linens will be soaked with body fluids, bleach solution with 1:10 ratio, meaning for 10 ml of your water, 9 parts will be your water and it will just be 1 part bleach. So that is your 1:10. Soak it for 10 minutes before you wash them using soap and water and repeat a disinfectant with 1:100 after you finally rinse them. Other important things is you will have a diary to monitor the vital signs of your patient and have an emergency number with you at all times. If your patient will have a progression of any of the disease, para po meron siyang natatawagan at any time. And of course, do talk with your patients kasi po nakakabaliw ang mag-isa sa kwarto. So sana po na monitor pa rin po natin sila, nakakamusta, daily, you can have video conferencing, you can call them via phone. And most important thing, of course, in the chain of infection, because they are susceptible, have their multivitamins always with them. And after their isolation, if they will be eligible for the vaccination, please do have their vaccination. Advocate vaccination po.
Okay, so I have a follow-up question with that since you have mentioned about hypochlorite or solution. So
Yes,
how
ma'am.
often do we prepare the solution?
So the solutions will have to be prepared on a daily basis. So your disinfectant will be ineffective beyond 24 hours. So dapat po freshly diluted po siya every day. So your regular bleach solution is already 5%. So that will be sufficient po. So still 1:100 and 1:10.
Thank you. So another question. So this is very interesting because I think during vaccination it can happen. So is it okay to do hand hygiene with alcohol while wearing gloves, then reuse the gloves instead of changing gloves? And what are the guidelines for reusing N95 po?
Actually, the principle, and I think the question is, nanggagaling po siya with the idea that whenever you will doff your PPE, we are performing hand hygiene in between the PPE removal. The idea behind that is we are relatively thinking na the microorganisms are somewhat decreasing every time that we will have the alcohol during the removal. Pero that principle only applies if we are already removing all our PPE and not because we plan to reuse our gloves with different patients. So meaning that if I will go to patient A, I will change my gloves, perform hand hygiene, don another pair of gloves before I go to patient B. However, in the whole doffing, if you will be assigned in a COVID area, in the whole doffing, before you actually remove any PPE, in between you are performing hand hygiene, meaning you perform hand hygiene before you remove your gloves, hand hygiene again before you remove your gowns, hand hygiene again. The principle is we are somewhat decreasing the possible contamination in our hands. Some of the facilities, even in NKTI po, we are still using two gloves for our COVID areas or hot areas, ang mga hot zones po namin with COVID patients, because we still have healthcare workers who have their PPEs for long periods of time, for relatively 4 to 5 hours, but they are changing their outer gloves in between patient encounters or every or every procedure with their patient. So that's it. So it's not a standard to to perform your hand rubbing and use the same pair of gloves to your patient. So no po natin yan. Okay? So we are just using that because of the doffing guidelines. Relatively thinking na nababawasan yung bacteria kahit papaano, pero during the doffing na po siya, removing everything at the end of your shift. How about guidelines in using your N95? There are some brands or manufacturers who already tested their N95 with different decontamination strategies. 3M also has it. They already have their studies when it comes to UV and of your HPV or your hydrogen peroxide vaporization, in which they were able to study that there is no decrease in the filtration efficiency and capacity of their mask whenever you will have this. However, CDC is saying that yes, you can reuse your N95 as long as it's not visibly soiled or contaminated with blood, with any respiratory secretions. It's not heavily soaked or heavily wet. You can still reuse them if they can still have the seal on your face whenever you will don them. However, if that particular manufacturer or brand do not have a decontamination research or decontamination recommendation, CDC is saying that you can reuse your mask for a maximum of just 5 uses. And you quarantine them for a minimum of 5 days. Meaning, I use my N95 today. Today is May 21. After today, I will put my N95 in a brown breathable bag. I will count 5 days from today. So it will be 22, 23, 24, 25, 26. On May 27, I can still use that mask after a minimum of 5 days of quarantining it. And I can maximize that mask for until 5 uses. However, in NKTI po, we're not using na po yung at least 5 uses. Minimum po namin is at least twice. However, if again your mask is visibly contaminated or it's already hard to breathe through, remember the mechanism of your N95 mask is that it traps the microorganisms in between the mesh. It has the capacity to do that. So whenever na po na nahihirapan kayong huminga dun sa N95, meaning punong-puno na po siya ng microorganism. That is also the reason why we do not touch the outside part of the mask, because it is full of the microorganism. So kapag hard to breathe through na po siya, please do not reuse it anymore, discard them and change them na po. However, for example, nag-visit lang naman kayo or once lang naman po kayo napunta sa COVID area, tapos 2 hours nyo lang siya nagamit, okay na okay pa yung mask. Yes, you can reuse them. Quarantine your mask for 5 days and then reuse them. I'm not sure with Qualiment if you will have the maximum of 2 uses per mask or you will maximize it into 5 uses, just like CDC is saying. But yes, you can use your N95. Question: can I UV my mask? You can do it. However, However, not all brands and manufacturers have a study for UV disinfection. It is safe to just quarantine your mask. So kahit po hindi natin siya i-UV, remember, UV treatment or UV disinfection of your rooms, for example, are just an adjunct disinfection technique, meaning mechanical cleaning and disinfection will still be done in your rooms. Ganon din naman po sa N95. Proper cleaning and disinfection of your respirators should be done. There are also respirators din po kasi that might be sensitive, or the materials might be sensitive to UV exposure. So please do read the manufacturer's instructions or the labels properly and search online, and so that you will be properly guided.
Okay, thank you. Another question from the MMT. Would you recommend use of UV light as part of disinfection protocol of patients' rooms or isolation?
And yan, medyo nahapyawan ko na po kanina, no, yung UV disinfection. Yes, you can do it. However, again, it's an adjunct, meaning an additional po na cleaning or disinfection strategy. Mechanical cleaning or using your soap and water, and a disinfectant using your bleach is still the most important part of the cleaning process. It's just an additional po, and there are limitations when it comes to UV. So one limitation will be the exposure to the light, meaning if there will be equipment or any part of the room that will not be exposed to the UV light, it will not be disinfected. Also, if you will be using UV disinfection, you have to take note of the wavelength. It should be UVC and a minimum of 254 nanometers. So your IPC should be able to evaluate your UV light. So again, it should be at least 254 nanometers po in terms of your wavelength.
Okay, for our last question, so would you recommend HEPA filter machine for protection of airborne transmission?
Your HEPA filters for your airborne transmission, there are two actual what do you call this? Actual application for HEPA filters. One is, if your room is a true negative pressure room, your HEPA filters will now be able to filter the exhausted air to the environment for it to be clean. However, if you will not have that isolation room and you will just have the portable type, your portable HEPA filters will now filter the air inside and be able to exhaust a somewhat relatively clean air. However, your portable filters po will have limitations in terms of the diameter or the distance to the actual patient zone. So, kailangan po na-assess din ng IPC natin, and including, of course, the engineering, the proper placement of our portable HEPA filters. Yes, you can use it. However, it will just protect within that certain diameter or area. And of course, hindi pa rin po nawawala yung katotohanan, because your room will not be a true negative pressure room, that whenever you will open the doors of your patient areas, or for example, operating room, for example, yung pong labas ng air ay pupunta pa rin sa hallway. So, hindi po niya na-prevent yun. So, yes, you can still use it naman, but please be guided of the assessment and the placement of your HEPA filters, and the recommended preventive maintenance and the changing of your filters as well. There are certain manufacturers who are saying that you can change your filters for less than 6 months. Some manufacturers are saying that you can change it for a year. However, it still has to be evaluated on the amount of aerosols present in your area or in the patient care environment.
Okay, so thank you very much, Miss Berna, for sharing all your expertise today, and we surely learn a lot from this lecture. So at this point, I would like to read the certificate of appreciation. So Qualimed Health Network presents the certificate of appreciation to Maria Lourdes Bernadeth Manipon Laxina, RN, MSN, for her expertise and valuable role as a speaker during the webinar entitled Basic Infection Prevention and Control Nursing Practices for COVID-19 Part 1, given this 21st day of May 2021 by a Zoom virtual event. Signed, Maria Gina C. Nazareth, MD, Vice President for Patient Safety and Quality Management of Qualimed Health Network. Manuel Francisco T. Rojas, MD, Senior Vice President for Medical Affairs, Qualimed Health Network, and Mr. Jaime Ismael, President and Chief Operating Officer of the Qualimed Health Network. So, Ms. Berna, I really cannot express how I appreciate the time you have given with us or to us this morning. So to share a lot of insights in terms of infection control. This is very relevant and with the challenges that is being posed by the pandemic, we really needed this. So thank you, Dr. Gina, again, and Ms. Berna for making this happen. So I would just like to announce the part 2 of our lecture series. The next lecture will be on June 4, 2021, Friday at 11 a.m. Our speaker will be Ms. Bena Arieta de la Cruz, Infection Prevention and Control Nurse of the National Kidney and Transplant Institute, or NKTI. Again, Ms. Berna, thank you very much. And for everyone who has taken time to attend this session, thank you very much and have a good day. So, okay, for better dissemination of information discussed in this lecture, a video recording of this webinar will be available in all nursing units, including specialized unit. So, yung mga hindi po naka-attend, we will still have the chance to catch the lecture of Ms. Berna. So again, everyone, have a good one and see you again on June 4 for our part 2. And thank you very much, Ms. Berna. Alam namin na very busy ka, but then again, talagang pinagbigyan nyo kami. So thank you again, Dr. Gina.
Thank you. Thank you, Berna.
Ms. Jay
Thank you so
Miranda of
much,
Marketing and IT. Thank you very much.
Thank you, Doc. If you will
Thank
have
you.
any questions po, please do not hesitate to reach us.
Berna,
Yes po, Doc.
sabihin mo kay Doktora Liquete, hindi kita ipapirate ha, kasi yun ang sabi niya sa akin eh, not to pirate you eh.
Opo, Doc. Noted po.
Thank you.
Opo, Doc. If you
Okay.
will need assistance po, okay po kami ni Ma'am Fe. Anytime.
Thank you very much.
Opo.
Thank you very much, Berna. Bye, everyone.
Bye, Doc.
Bye-bye po.
Bye po.
Thank
Thank you, Ma'am
you.
Vanji. See you on June
Thank you
4.
po.
Bye-bye.